Okay. Hi, I'm Dr. Walsh, and if you're watching this video, you probably responded to one of our Facebook thyroid ads, and I just want to get some information out to you because I know this is a deep dive, and I just want to open your eyes to how difficult it can be to figure out this thyroid, hypothyroidism, or Hashimoto's. So in this email, I'm going to send you an example of a test that kind of shows you, but there's 32 different things we test for gluten, and there's like 25 cross-reactant foods we test for, and then we also can test for leaky gut. So when I meet with people, they typically have all these things going on. They're not sure how to fix it. Their medical provider has not helped them up to this point. They've basically managed their TSH, but it's more than TSH like we talked about. You have to look at some other things. So what really got me into this is I had the thyroid issues and my daughter had it, and we had to deep dive into this to really figure it out. Otherwise, who knows where we'd be today. And we talked about the crazy lazy syndrome. My thyroid condition really didn't affect my GI tract. It affected my brain fog. I almost came down, I would say, like a mood disorder. I was moody, I was anxious, I was irritable, and my wife's a therapist, so that doesn't work out too well. And she's the one who finally said, you need to figure this out. You know what to do. I knew at that point it was food, and it was difficult. So I know what you guys are going through, and if you need help and and you're on this journey, that's something I can help you with. I really enjoy treating thyroid patients, especially Hashimoto's patients, because I had it myself, and like I said, my daughter did too. And we did medication. Sometimes medication is necessary, but at one point they were wanting to put me on high blood pressure medication, anxiety medication, ADD medication, and thyroid medication. And today I'm not on any medication. But it did take me a while to get off the thyroid medication. Thyroid medication can be necessary. So I just want you guys to know that there is hope, but it does take time, and it is a process, and there is testing. And most insurance companies don't pay for the testing. That's the unfortunate side of it, because they don't believe in it. There's nothing they would change other than medication. And when I went to my doctor, this was a 2-year process. I went to him and was on medication, and they kept wanting to put me on these other things. Well, one of the last times I went to him, the final straw was my blood pressure was really high. It was like 170 over 40 or something crazy like that. And they didn't want me to leave the office, but I didn't feel it was high. I felt normal. But I guess the main thing is that's why they want to put me on all these medications, is because they couldn't figure it out, and the thyroid medicine wasn't doing it. It was some other things that were doing it, and I finally had to test for. So that's where I come in and help people do that. Like I said, we test 32 different things for gluten. Usually if you go somewhere, they might test one of them, the most common one. And then another thing is they look at celiac, and they'll say, well, I've been tested for celiac. That is 70% of your gut has to be gone before you come down with celiac. And if that's related to thyroid, sometimes you'll have GI issues and they'll go there. So this can be pretty complicated. So my thing is I like to come in, help you get through this fast. It's usually about a 6-month process. And if you're interested, we do offer health assessments. If you're in our area, you can come to the office. We can meet one-on-one. If you're not in our area, we can do it over the phone. We can do telehealth, and we can reach out to you that way. I do charge $100 for the consults or the health assessments, because I'm looking over your medical information and getting a thorough history, and those usually last about 60 minutes, sometimes longer. So we will deep dive into this. So if you're really interested, I only want those people who are really interested. If you're okay with your medical provider and you're content with where you are, that's fine. But if you're having symptoms still and you've been on medication like I was, and they're wanting to put you on more and you just don't feel right, then you might want to try this. So if there's anything we can do, we'll let you know. But the health assessment is $100, and then the testing from there, it goes anywhere from $400 up to several $1,000s up, and it just depends what you need. Sometimes people need very little testing, sometimes people need more, but I'm real effective at treating the thyroid issues. So I hope this information is helpful. And if you don't want the health assessment, you can keep listening. You can get my emails, and you can get my Facebook post, and you can just educate yourself and maybe find a way to get out of this mess. But I hope this was helpful, and I look forward to helping you. Okay, thank you.